The intraaortic balloon catheter is now ready to be inserted. Backload the guide wire through the tip of the IAB until the proximal end exits the luer on the catheter bifurcation. Maintain control of the guide wire at all times. Advance the balloon over the guide wire and through the sheath, and position it 2 centimeters distal to the left subclavian artery, using fluoroscopy if available. Remove the guide wire from the central lumen. Connect the 3-way stopcock with 6-inch, 15-centimeter extension tubing to the central lumen. Withdraw 3 to 5 cc's of arterial blood to confirm central lumen patency. Then flush with at least 3 cc's of heparinized saline. Attach to a heparinized constant infusion system. If the sheath with a side port is used, the side port should also be attached to a heparinized flush system. The use of a transducer is optional. If sheathless insertion was employed, the following instructions should be followed. Apply manual pressure to the insertion site for 1 to 2 minutes to control bleeding. The hemostasis device is designed for use whenever manual pressure is insufficient to achieve hemostasis. If bleeding persists, advance the tip of the pre-mounted hemostasis device into the femoral artery until blood exits from the hub side of the hemostasis device, and then advance an additional 1 to 1.5 centimeters. The shortest length of the hemostasis device required to effectively control bleeding at the insertion site should be inserted to achieve adequate hemostasis and reduce interference with peripheral flow. Attach the cuff to the hemostasis sheath or hemostasis device. If the hemostasis device is not required, you may advance it to the skin level or peel it away from the catheter body. For patients with more than 2 inches of adipose tissue at the insertion site, sheathless insertion is not recommended. Ensure correct IAB position. Release vacuum by removing the one-way valve with a gentle rotating motion from the connector on the short Tygon tubing. Attach driveline tubing to the catheter. Prepare for pumping by inserting the color-coded connector into the intraaortic balloon pump console. Arrow balloon connectors automatically determine the correct balloon displacement volume to be delivered by the pump. Follow the intraaortic balloon pump operating instructions for console startup and safe operation. Observe inflation and deflation of the balloon under fluoroscopy if available. If the IAB does not unwrap, confirm position. If position is correct, manual inflation may be utilized. To perform manual inflation, disconnect the gas line tubing from the catheter body. Using the 60 cc syringe, attach it to the helium port of the IAB connector. A stopcock may be used if desired. Withdraw and confirm no blood is present. Using 30 to 40 cc's of air, gently inflate and deflate the IAB manually. Alternately, manual inflation may also be performed by removing the color-coded connector from the console, attaching the syringe to the middle port, gently withdrawing to confirm no blood is present in the gas line, and gently inflating. Reattach to console and resume pumping. Observe the balloon pressure waveform for its normal morphology, indicating a properly functioning balloon and proper sizing. Verify timing by obtaining a strip chart recording of the arterial pressure waveform. Secure catheter to the skin at the hemostasis cuff and at the catheter bifurcation to reduce the risk of catheter migration. Use only the wingtips designed for sutures. Avoid anchor sutures around the catheter body. Apply a sterile dressing to the insertion site, as described by hospital policy.